Welcome. Great to be in a room with such distinguished colleagues. And I'm Bruce Bartu. I served for 30 years in healthcare philanthropy as an executive leader in a number of health systems, and recently transitioned to my own consulting practice intensely focused on gratitude and the power of gratitude in healthcare and philanthropy. And as I was making this transition, I was reflecting a lot on the partners that I worked with in my time in healthcare philanthropy that really helped transform what I was able to accomplish as a leader and the incredible work of the teams that I had the privilege to lead. And so I've asked some friends and colleagues to sit and have some dialogue and discussion about how we transform philanthropy in healthcare. And these are cutting edge leaders among the best firms, I think, in the industry, in the innovation space. And so I'd like to introduce each of them to you. I'm going to let them introduce themselves, tell where they're from, and what their organization does. John, let's start with you.
Yeah, thanks, Bruce. John Simpson, co-founder and co-CEO at Digital Health Strategies, and we are a data technology and communications firm. We work exclusively with healthcare providers, and we have a product called Honor Your Caregiver that focuses on grateful patient acquisition and converting patients into donors. And I think, as we'll talk about today, a big focus on gratitude and how we engage with patients around their gratitude and their care experience, and use that to build a relationship with them as donors. And so the services and solutions we provide span that acquisition phase, but also the ongoing lifetime of a donor through mid-level giving as well as major planned gifts.
My name is Jeff Canoe. I'm Vice President of Sales for Stratus Live. And like Bruce, I've been in the business for about 30 years and providing technology infrastructure and services to support philanthropy.
Awesome. Yeah, thanks for inviting me, Bruce. And Nathan Chappell, the Senior Vice President of Donor Search AI. I spent 20 years fundraising, but prior to that, I was actually started two technology firms. So back early in the .com days and digital scanning days, and then found my way into nonprofit for 20 years and served as, among other roles, Senior Vice President, City of Hope, where I managed a fairly large, complex fundraising team. But while I was a fundraiser for 20 years, I always had this operational kind of lens as well, and really got big into data and computation. And we essentially built the first algorithm that was essentially quantifying all the healthcare data and experiential data to essentially determine which individuals are most likely to give. And fast forward to today, AI is much more of a buzzword. I would say I did AI before it was cool, but it's amazing how this technology has been exponential and how different it is now even from 5 years ago, and how we're seeing really this type of technological infrastructure change and provide opportunities to healthcare organizations that were never possible before. We can talk obviously more about this in a little bit.
Yes. Great, thank you. So I would just say to colleagues who are philanthropy leaders in healthcare in particular, if you're not every day thinking about your digital health strategy, your platform there, AI, and data systems and those elements, then you're not living in reality. And I know my colleagues who are philanthropy leaders are wrestling with these things every day, and there are lots of options out there. The reality is, though, there are only a few organizations, I believe, that really intensely focus in the healthcare sector, that understand what the future of healthcare philanthropy is all about. Yeah. And frankly, we've talked about gratitude. I'm deeply passionate about it. It's a major platform for advancing philanthropy and healthcare. But in order to do that successfully and build a gratitude-inspired philanthropy program, you've got to make good decisions about who your strategic partners are going to be. And they have to be partners willing to partner with you, not just sell you a product, but actually work with you and customize and understand where you are in your journey to transform and how they can be helpful. And to my colleagues sitting here today, you all are at the top of the game. I really believe, and I'm confident saying to my colleagues, they're among the top firms and people that I would recommend working with. So
Thank you. And if I could add to that, Bruce, having worked prior in other types of fundraising and then transitioning halfway through my career into healthcare fundraising is absolutely the most nuanced and most difficult form of fundraising there is. And it's complex because you add very confidential elements that we're sometimes privy to that are either appropriate or inappropriate to share. It's difficult because there's such a wide range and number of possible donors, but only a small percentage ever give. It's also complicated by the aspect of we call it the tears of gratitude dry quickly, is that time is essentially an element that we see in healthcare philanthropy that absolutely determines whether or not someone will activate as a donor. No other form of fundraising has that confluence of those other things all together. So I think, and I appreciate you being here and everything that you brought to the table, and obviously followed you and your career for a long time, is like understanding all of those things and then how to essentially align with and work with other applications outside your organization. I don't want to steal any of your questions here, but it's something that's so nuanced and so big and so complex that unless you're very deep in the space, you only have one piece of the puzzle. And I see a lot of other vendors that just like they see a little bit of it, but they don't really truly understand or are immersed in the complexities of healthcare philanthropy.
Yep. Yeah, I would agree with that. And I think that there's one of the things that we see, we have done a survey over the past 3 years, and one of the things that came out of it is in terms of data and the use of data, to your point about nuance, is 64% of respondents, this was hundreds of health systems across the country, either don't know whether their data is valuable to them or say, no, it's not helping. And
Right.
I think that a lot of this has been trying to apply more crude or models or tools from outside of healthcare into healthcare, and looking at things like, giving capacity or net worth, and using that as a model. And I think that ignores the nuances you talked about, the recency or the type of care encounter that someone has had, other data points about them, and really building on this concept of gratitude, which is so different than other types of nonprofit fundraising, where so much of this is built on your personal experience and your personal relationship with this organization. And that's also not even to talk about the fact that so many people don't even realize that the health system is a nonprofit. So I think that there's a lot of education that needs to occur around this, and looking at the stats, where what's sort of the current state, and instead of leading with the bright shiny object or the new tool, how can you educate about the value and the opportunity, and then understand, okay, what are the right tools? What's the right toolkit that we should be bringing to the table when so many people have got the wrong tools? They're using a screwdriver when they need a hammer, or whatever the best analogy is there.
Yeah. The sources of all that data have expanded so much, and where you get that data and the security around that data, and bringing all that together and then figuring out how to use it. AI is going to help a lot with that, I think, in days coming by. We talk about things in layers, and we talk about systems of engagement. So that's got to be a two-way communication. We got to allow our constituents to engage with us and tell us how they feel and tell us what inspires them. So we need to provide those systems. And then once we get all that data, because of the volume of it, we need systems of analysis. And that's where things that you're talking about, Nathan, come into play to say, how can I use this data to make a personal connection with people? And then the third layer is systems of record, where we pull all this stuff together historically from all these sources, and now try to build a picture or a profile that the fundraisers can work with. So it's really a fairly complex network that has grown more and more as the sophistication has expanded.
Spot on, all three of you. And I think what's really unique for us here, and we all recognize and understand this, the healthcare space is so different. And John, you made the comment about being a not-for-profit. Most people don't think of healthcare as a not-for-profit. They're not tuned to, I'm going to just give to my hospital or a healthcare organization. They think of it as a business. And it looks like it's a big business with big money in the big business. And the reality is very different from that. But we also know my deep passion around gratitude, we know that gratitude is the most inspiring element of a family choosing to make a significant philanthropic investment in healthcare. And to have the tools and technology and strategic partners to help a healthcare organization understand who are those people, what's their likelihood that they might not only be grateful but potentially philanthropic, and how do we manage the data around that interaction? And it's not just, I've watched in my 30-year career going from having a donor database where we captured information when people gave to now having CRM where we're talking about these are the physicians that understand gratitude and are partnering with us. And we have a record in the system of who those physicians are and what their likes are and who they would most likely be willing to connect us with. It's that state of the art that's critically important. And so my question, first big question is, how do we take the notion that gratitude-inspired philanthropy is the wave of the future, is what we should all be doing a lot more of, and how do we build the infrastructure and make decisions around building the infrastructure to support that model? That's really different than doing a ton of events and doing a ton of, John, you and I have talked about this, a ton of direct mail, just throw everything against the wall and see what happens. It's, in healthcare, it's so different. People feel this deep sense of passion around gratitude, and it's not just in the moment. We've had philanthropic partners that chose to invest 20 years after they had a care experience. They've been holding on to that gratitude that whole time. So what is your thinking on what are the best tactics in terms of building solid infrastructure, state-of-the-art advanced infrastructure to support a gratitude-inspired philanthropy program? John?
Well, I mean, one thing that touches a bit on the gratitude piece specifically, but more generally, is healthcare as a whole, starting with the delivery of care, is risk averse, right? Do no harm. And so your anecdote about sending a bunch of direct mail, continuing to do what has been done in the past is the easy button. Like, I'll just continue with what I'm doing. And in the context of all this change happening and all these new things coming out, it can be extremely overwhelming. And I think even the term infrastructure is scary because that means a lot of time and a lot of investment. And I think that what systems and foundations need to be doing is thinking about what are opportunities to be focused and identify the opportunity to test or pilot in a way that does not mean you need to bring in 10 new systems or you need to tear down what you have, because a lot of the issue is, oh, we've got all this data and we're getting more data here and more data here, and all it's doing is it's overwhelming. And it's not leading to better decision making or better donor engagement or conversion rates. And so I think that a lot of the work that we see is, we make this sort of analogy of, it's like giving a kid that's 16 years old that just got his driver's license a Maserati. And they don't know they don't even know how to drive yet. So it's how can we show them how to drive a Camry or a Civic first and then move into the Maserati? And I feel like the gratitude piece is a great area where it's, okay, there could be additional data that you can have access to, or there could be additional automation tools that you could use. And if you isolate a specific audience or you bring in gratitude as a trigger point, that gives you something that you can say, okay, here's specific people, and we're going to look at them and bring together data and technology and high touch interactions and prove out a model that can then be scaled. And so I think that's just one comment. Interested to hear your feedback on that, where infrastructure data is so daunting, how to make it, just from a philosophical standpoint, people can wrap their heads around it, but then also from a budget and resource perspective, it's okay, this is achievable.
Right.
And I can see how I could do this in the next 12 months versus, all right, we're talking about a 3 to 5 year plan.
30 years ago, philanthropy wasn't what it is today. We were bringing out systems that did function a certain way. We said, if you gather this data this way, report on it this way, you can structure your campaigns this way, and we almost were teaching the fundraisers how to go through this process. And those were pretty specific infrastructure pieces that functioned a certain way. Today, the profession has exploded, it has expanded, it's gotten more sophisticated, like you mentioned, Nathan. And systems today are not designed to be that structured. They are structured, but they are also designed to be extended to say, okay, in addition to that, we need to take advantage of AI, we need to take advantage of other data sources and other strategies so that it can grow with us. And I think that's really critical for the infrastructure. But you have to have a plan around that, and I think the plan should follow the strategy set out by the chief philanthropy officers for sure.
And Nathan, I would just venture to say what's critical in all that, I've certainly learned in my experience, is that this is not a function you delegate to an entry-level staff position. Back in the day, it might have been, I have a database person.
Yeah.
Now, this is a very strategic element
Yeah.
of the vision for your operation. And to your point, Nathan, the work you're doing in AI just elevates the importance of it. You've got to really have skill set and focus.
Yeah, and I think it even starts before that. If I go back to why I started working in AI within healthcare philanthropy, it was essentially what I didn't know the term at the time, but I knew that every year I was asked to raise more money from less people. So going back to what has worked in the past is not going to work in the future.
Right.
In fact, even today, I had conversations with a successful healthcare philanthropy organization that said they just did this deep analysis on all of their donors, and they've realized very quickly that they have been able to raise more money every year, but every year they raise that money from less people. That doesn't end well. So I think you have to start with this fundamental belief, in two fundamental beliefs actually, in my opinion, is first is that gratitude does not equal wealth. And somehow in our industry, this narrative is flipped, and probably through the advent of traditional wealth screening, which is that if I, at a very low cost, can screen every single patient, find the wealthy ones, and then put all my resources on those wealthy ones. We've created this script that gratitude equals wealth, and we know intuitively that it does not. At the same time, the US and the UK and Australia and Canada have all declines in the percentage of households that give. Those patients they're feeling bombarded, they're not altruistic, they're getting all these appeals, and it reinforces this notion that giving is transactional. So I think we have to recognize the belief that gratitude does not equal wealth. We have to find another way. But the other is that I think the pain has to be great enough that at a certain point you realize what got us here won't get us there. And I don't know that there's this magic wand, easy moment to say, we're going to take all of our data and create a data warehouse, and we're going to mine that data using AI, and we're going to bifurcate the strategies and with your tool and all that. The reality is, no one said it was easy. Like, the reality is, if the pain is great enough, you'll prioritize the resources and the incentives to make this a priority. If you fully understand and admit that how we got here is not going to serve us well in the future, at that point, we've always talked about this, like, data having a seat at the table. Very few organizations even have a chief data officer, let alone if that officer is an executive team member of a philanthropy team. So I think it starts with, like, recognizing the priorities have been, well, out of whack, in the sense of, like, now there's really no future moving forward in a sustainable way that doesn't prioritize data and analysis and use of that data. And then two, that it's not a silver bullet. I think what the other aspect that I find is that people are like, if they go through and they have a small appetite to make some change, that fundraisers want that silver bullet. It didn't solve all my problems. AI is a failure. Prospect development people spend every waking moment to disprove why the math of AI is not the same as intuition, because it's math. And so this is a really big moment in our industry. And I truthfully, and I'm probably super biased in the fact that I wrote a book about it, but I've become more and more concerned by the appetite that healthcare philanthropy has for change. And I feel that the next 24 to 36 months in how our sector reprioritizes the use of data and systems to help drive smart decision making will define entirely the future of our sector. Not to sound doom and gloom, but I think this is an inflection point and that sounds like a buzzword, but for real, that if we want to stay relevant in our ability to make quick, accurate decisions about where to deploy resources, to stay competitive with what consumer expectations are, and every person who wakes up and turns off their Google alarm clock and puts on their Nikes and buys a Tesla because they're like saving the planet, that we have to shift in a big way. And I think this shift is the shift that needs to happen. We're good on fundraising, soft skills, and really EQ. I think understanding gratitude is a big flip, but how we get there and do that at scale is really the important part.
Yep. I think to that point of the change, that change is hard. And I think to your comment about where this sits in the leadership structure is really important, because it needs to be established at that leadership level. I talked about healthcare being risk averse. Healthcare is also very hierarchical, right?
Yeah.
And so people are not incentivized to go against the norm or what their senior leader has laid out. And I think as you were talking, the example that came to mind is thinking about like a constituent record in terms of the structure that exists today. We've done this activity of looking at a constituent record and working with a major gift officer or an annual giving team member and saying, let's look at a constituent record in your CRM, and which tabs are you even looking at? Which of these are even useful? And finding that a significant percentage of the data and information that's in there is not being used.
Right.
There's a lack of understanding of what it even is. There's an arbitrary number that's been assigned to somebody, and the database lead is sitting on the side going, I've just spent like a year filling in all of this information. And I think that to have this more open discussion and saying, okay, frontline fundraiser or prospect research team or annual fund lead, what is the information, not even talking about a data point, but what information is valuable to you or have you used in the past that's going to help increase engagement, allow you to better engage with a prospect or a donor, and that lens or framework to drive where investments are made or how to think about, okay, back to my point about the toolkit, what tools do we need? Instead of saying, these are the boxes and let's just keep trying to fill them in without actually thinking, is this even valuable? Is this helping improve our results?
Yeah.
And so, I completely agree that this is a time to do that. And I think, back to my previous point, I think there's ways to do it in a focused way of saying, let's try something different at a specific hospital location or with a specific set of physicians or specific donor audience, and show that this is working to create more of a culture of change. So people say, okay, this is working. Now let's all invest our time and energy towards scaling it.
Yeah, that's a great observation, John. The volume of data has gotten, it's what we've looked for, is all this data from all these data sources. And what we really want to do is take that data and focus it down on a persona basis for each individual in their job. And to get back to what Bruce is talking about, is what really motivated this and why are these people interested in us in the first place.
Right. And I have to say and make the observation that just over 6 months in this work as a consultant trying to advise colleagues in the industry on the importance of gratitude and the power of what that means for your philanthropy program, I am struck by how many of my colleagues have made comments to me about, we don't really have the available resources to do a gratitude program right now because we're investing in technology. And my response to them has been, those two go together.
Yeah.
It's not one or the other. The latest wave of the future is not just AI. It's AI, it's the right data infrastructure and the right digital platform and all these pieces, as well as a philosophy of gratitude inspires the most significant philanthropic investments in healthcare. If you're not doing those things together, then you're missing out. In fact, I had a conversation recently with someone who said, I had limited budget this year, so we went on this technology platform. We're doing some really amazing things in that area. And I said, how's the follow-up with folks? We don't have the resources to do that.
Right.
So they're capturing all this data. It's probably going into a nice system somewhere. And to your point, somebody's loaded it all in there. They don't know what to do with it.
Yeah.
And the reality is, while all that is happening, in their hospital, there are people every day expressing gratitude. They're totally missing the opportunity. And so that's why I wanted to facilitate this dialogue and just make a humorous point, if you'll allow me to do it. We're sitting here at the AHP International Conference in Orlando. Took a little break before the evening events on Thursday evening, and we're in a hotel suite here, and outside, just as we came in, there was a severe thunderstorm. And we were having some small talk around, oh my gosh, I wonder how our session's going to be with a thunderstorm in the background. And then we agreed and made the observation, isn't that fitting? Because that's really what's happening in healthcare today. There is a severe storm. And how are we responding to it? Let me tell you, what feels really great to me is I'm sitting with a group of leaders with Donor Search AI, with Stratus Live, with digital health strategies. Hopefully the Gratitude Health Group will be viewed as highly as you all are as we get up and running in our firm. But looking outside, I see the sunshine. And what that says to me is there is hope.
Yeah.
We'll get through the storm,
Yeah.
but we got to do it together.
I think as I'm reflecting on this, as we're talking, the reframing of the word gratitude, right, almost instills in itself and necessitates relationship, like longer term. Like gratitude is not episodic, right? And so much of fundraising in healthcare is episodic that look at our retention rates on average, like newly acquired donors, like 19 to 21% on average. And because we've treated fundraising often as episodic, we're using very limited data that doesn't speak to a person's connection. It's really just they showed up. And so I think if that reframing happens and the incentives, and you mentioned incentives earlier, the incentives are aligned to reinforce relationship, gratitude, like a longitudinal way, then we have a chance. The reality, and this is part of the challenge, and I won't be too pessimistic here, but part of the challenge with CDOs that I talk to is that while they might believe in gratitude and they might have money to invest in systems, the way they're evaluated is based on filling a leaky bucket. And so the incentives for most leaders right now are not to reinforce and foster an increase in relationships. It's just to fill the bucket and to move on. Mm-hmm. And so I think what you're doing, Bruce, in creating that reframing is like, this is something that gratitude represents a longitudinal relationship, not an episodic behavior. Then what's also really unique about healthcare philanthropy versus any other is the depth of experiential data and fairly consistent data. If we think about a higher ed experience, lots of data. A student had experience, they live on campus or off campus, did they get parking tickets, when they graduate, did they get which degree and how many and what grades did they get? And that's just like Wild West. There's a lot of experiential data, but none of it's consolidated. But healthcare organizations are very good at billing people and insurance companies. So they're pretty good at quantifying who did you see, how often did you see that person, that department, was it inpatient or outpatient, how many days? And that's the exact data. When we started working this in 2017, the hypothesis was we had really good patient outcomes. Press-Ganey scores were off the charts, but we had a really nascent major gift program. And the philosophy and the hypothesis, what if we could quantify, rather than a person's wealth, let's put this away, not even look at it, but what if we can measure the depth of a person's connection, literally like how well do they know us? And why don't we use that as a barometer for what type of strategy do we use, and use it under this frame of gratitude in the sense of, are they someone that's going to go the distance with us, or are they just a one-time donor that's actually going to cost us money in the long term? And that's a big shift for an industry that is very bureaucratic and very slow to change. But honestly, I think probably the most important shift is like start with the right incentives that incentivize relationships and increases in retention and lifetime value. Money will come very second to that. But then at that point, quantifying all that using the rich data that healthcare philanthropy has at its disposal in a pretty consistent way. Not always easy to get, we can talk about that later, but consistent compared to almost any other fundraising type of entity. And it's there for the taking, I guess is what I'm trying to say. It's just, it has to come with that reframing, and then the philosophy and the belief that we can measure connection, that giving is related to the depth of connection. And if you can increase the depth of connection over time, then you're going to be successful. If you're not and people opt out, then that's a whole nother story.
Yep. Yeah, I think that the completely agree with everything you're saying, and that's one of the things that we look at from a data perspective is actually saying and setting the expectation that let's take wealth off the table. Let's actually not even look at wealth. That should be a driver of the level of ask.
Right.
But
Absolutely.
all of those other factors you're talking about the level of connection, that should be driving your decision making. And when you think about growing a relationship with somebody, regardless of wealth, that there is, and you talk about this, Bruce, there's a responsibility on behalf of the health system, not just the foundation, of stewarding that and looking at all that available data to understand what the history of the relationship is, what the potential for the future relationship is, versus just a blunt wealth score to prioritize. And I think that's where there's a lot of missed opportunity. And the other thing, I think to the point about benchmarks and data is, whether it's a 20% retention rate or other metrics that we're looking at, I think there is an importance around expectation management that, yes, you have, depending on your size, tens of thousands, hundreds of thousands, millions of people walking through your door.
Right.
You can have a relationship with them, but it is going to be a small percentage of people that are going to give to you.
2%.
Right. And
average.
so like that, so I feel like the allocation of resources is so skewed that it's all this time and effort put into how can we grow those big numbers versus let's hone in on highest value, who we have a strong connection with and we can grow over time. And even if we do have, that could switch from a 20% retention rate to a 60 or 70% retention rate, but you're looking at a smaller audience. To your point earlier, well, we're all about acquisition. You've got to keep the pipeline going.
For sure. Yeah.
But I think my main point here is the allocation of time and effort is that ratio is completely off. There's a huge percentage of time that's spent on low value or low opportunity because folks are just looking at the wrong data.
That's very healthy.
And that acquisition, I've often focused on this in my career, that acquisition is really around inviting people that have had some experience along the line to express themselves. And we may talk about, I love the way you described it, Nathan, a donation is transactional, it's a one-time thing. A philanthropic partnership is a relationship. And people have a relationship with a healthcare organization. And actually, let me correct myself, I said it intentionally that way so I could correct myself. This is not the organization, it's the people in the organization. That's the difference in healthcare. I have a relationship with my alma mater.
Right.
In higher education, it's institutional. In healthcare, it's the people. It's the care team. People have a relationship there. When we're inviting people to invest through philanthropy to advance the work of that care team, that is so different than transactional fundraising asking for donations. And we've got to build infrastructure, in my opinion and my experience. We must build infrastructure in all these areas that supports that mindset that we're not interested in transaction. We're interested in transforming how we invite people to take their existing partnership around their care experiences and invest through philanthropy if they're a philanthropic family. And I'm also pretty obsessed with using the term philanthropy because it's the love of humankind. That's happening every day in healthcare, put the money aside. But people who are philanthropic and charitable in their lives, that's the way they're going to choose to express themselves. And they deserve the right to do that. In fact, they expect to be invited. And we need to be doing that, but we've got to be doing that understanding who they are, what their experience was like, and how we're managing all the data, and understanding how AI can help influence the decisions we make. Because look, no program is ever going to have enough resources to do everything they'd like to do.
I think that's exactly it, right? And that's the other side of it. And you talked about this. Acquisition's always important to continue to build a healthy pipeline, but I think the philosophy in our industry has been more is better in the past. It's just spray and pray or whatever you want to call it, just more is better. And in most of my career, that's what I did. I just threw more money at it. And in the fact that, frankly, we knew we lost money when we acquired a donor, but just mathematically, just by a little bit, those that had a higher lifetime value would actually pay off. And, and it really, it's what we had at our disposal at the time. But now, frankly, using AI and quantifying the connection, we realized first in our very first data science project that giving really had less than 10% to do with wealth. Wealth is a really poor indicator of altruism and even becoming less and less over time. But at the end of the day, it's like, how do you, on average, average hospitals, around 2% of their patients make a donation. If you could find the right 2%, or if you increase it, the highest we've ever had is 11%. If you can increase 2 to 4 to 6%, those people have a lifetime value of around 16 times a one-time donor. So limited resources are key, right? So this is the other area. Like, healthcare has more constituents at their disposal than any other type of fundraising, but it truly is a needle in a haystack. So how do you leverage all the data that you have by aggregating it, apply some really strong math to it, have really solid fundraising strategies attached to it to make sure that everything is working together? And I think that's this combination right here, is that it's not one thing. It's the incentives have to be right, the data has to be stored in a place that's accurate and available for use, it has to be computed, and it has to be delivered in a way, all very quickly, by the way, that you can really activate not more donors, but better donors, those that are going to stay with you. And then, by the way, measuring them continually over time, because some people will lean in and be like, really respond to those connections and really want to be a part of that partnership. And others will are like, I'm good. Like, I gave that one time, it was just that one thing, and I'm really not a giver. That's okay too. Like, we always say, the bless and release. Like, it's really becomes around efficiency at that point.
Yeah.
You know, we talk a lot about engagement scoring. That's not a new thing, but it's always been what you were talking about. Historically, it's been transactional. We assign some kind of a weight to certain transactional kind of activities. This really, what you're talking about, really changes that whole thing. There are different qualitative characteristics that go into engagement now, and how we capture that.
Yeah.
It's going to be interesting.
If I could add, one of the things, most interesting things we found using AI in this space in healthcare is that in the beginning, it was just the belief of, we have 2 million patient visits and 2% give. Like, how do we find them? And we treated like all donors and non-donors the same. And frankly, because the technology was very expensive, and from an AI, we were really pioneering new stuff that Google was doing, and they could because they're like gazillionaires. And it was expensive, and we had limited success. We found that we could find donors that would give again, but it was really hard to find non-donors. So we were like, and as an industry, I think for around 40 years, we've always like looked at donors and non-donors the same, just constituents. And if you measure a non-donor against a donor, what happens mathematically is a non-donor always scores low because they haven't made a gift. But if we take out wealth and we take out giving, and we measure people based on who gives based on their connection, we build now separate models for donors that are going to give again from non-donors that are going to make their first gift. And it turns out, when we look at the variables in machine learning, they're called features, but when we look at them side by side, the two models don't look at all the same. So it turns out that almost every single time, first-time donors to a hospital are largely based on the depth of their clinical experience. Not all departments are equal, not all clinicians are equal, right? There's some that are really good and some that are really bad, and some are really good clinicians but have horrible bedside manner. The data doesn't lie. It shows over time the people who had responded and made donations to those types of clinicians and departments, essentially help the model learn this is a good attribute or a bad attribute. When we look at donors versus non-donors, the non-donor is largely based on clinical experience and the depth of their experience. Once they become a donor, the repeat donor model learns that it's all about how you stewarded them. How did you embrace them? What type of language did someone call them, or meet if they attend an event or whatever it might be? And it's amazing to see that transformation that has shifted from, okay, now you brought someone in based on they already knew you, and now you have this really great opportunity to foster and deepen a connection based on those more experiential type data points. And only now, and not to say that this was broken in our industry, I think the technology has only now allowed us to do this at scale affordably, but it's transformative in our thinking. We've been doing this for a really long time, and it was a lot of spray and pray, and it was a lot of like throwing spaghetti on the wall and going to lunch with a ton of people that we had no idea if 18 months later one of us would cry uncle, like them or us. And I think the paradigm shift in our industry now, with the advent of big data and technology and AI and really like real-time fundraising strategy, should, and I guess this is the big operative question, it should transform healthcare philanthropy. Whether or not our industry has the appetite for change or wants to just go back to yesteryear and do things the way we've always done them, that's a whole different story.
It is. I appreciate this dialogue. I hope this is the first of a series of conversations that we can have to help guide our colleagues through some really important decision making and strategic planning that needs to be happening in our industry. And I would just say this impresses me most about each of you and your firms and your teams is how well you partner with philanthropy leaders and their entire team to constantly reinforce through the work that you did every single day the language that's important to the future of our industry, right? We're transforming, we're not doing transactions.
Right.
We're not soliciting contributions anymore. We're inviting people to express themselves through a philanthropic partnership. And those are nuances, and people sometimes think, well, that's not that big of a deal. But Jeff, when we worked together in my last organization and we were bringing Stratus Live in, the ability to go in and do some customization in there and reinforce for our philanthropy team every day, you're not thinking about the right time to solicit a gift. You're thinking about what was the care experience, what's the level of gratitude, who's the care team that they're grateful for, when are you going to extend an invitation? And to have structure, infrastructure in your organization that's constantly reinforcing for your team, that's the mindset they should be working under every day. And we're doing emails, we're doing a platform that's inviting people to express their gratitude, not just make a transactional contribution. Right. That constant reinforcement of the philanthropy teams is what's going to transform our industry. And leaders need to make the decisions, in my opinion, to partner with organizations that are going to be partners to help their teams stay on that transformation train. Really appreciate this dialogue. Appreciate you all taking time from busy couple days at a conference. And I hope this can turn into a series of discussions. And I hope our colleagues find it to be really valuable. So thank you.
One more hour, we could probably solve all the problems. So
we're on our way.
Let's go for it. Yeah.
So
thank you, Bruce.
Thank
Bruce.
you very much. I appreciate every one of you, Nathan and Jeff and John and your firms. Just a reminder, Digital Health Strategies, Stratus Live, and Donor Search AI, and happy to be endorsing as the leader of the Gratitude Health Group.
Excellent.
Partnering with firms like this.